All right, so before the break, we were talking at the great news in terms of record numbers of people being vaccinated in South Africa, but some issues when it comes to vaccinating elderly rural residents. And we're joined now, let's hope he can hear us, Program Manager, Health Systems and Policy Rural Health Advocacy Project, Russell Rensburg. Mr. Rensburg, I was asking you about the situation. Reportedly, quite a percentage-wise, quite a high number of people dying in rural areas, even though the vaccination rate is slow.
I don't think we can really get to a point now where we can unpack the numbers, but there are on excess deaths and access to vaccinations for rural people. However, I think in the early days of the 60-plus, rural provinces like the Eastern Cape, KZN, Limpopo and others have actually done quite well in getting people to vaccinate.
Yeah.
I think the challenges that we're facing at the moment is that as we're expanding the people who qualify for vaccines, there's growing inequity in who is getting vaccinated. And I think we are experiencing some challenges, particularly around the need to register and be available on site. And I think what was needed for rural areas is different strategies to ensure that the people that need to get vaccinated get vaccinated. Over. So
are those strategies there? One of the issues is the distance it takes to get to the local clinics, say. Are mobile clinics up and running and working?
I think in some places mobile clinics have worked well. I think the MRC is running a project at the moment where they've gone out to some rural areas and did vaccinations in ground queues, and I think that had actually had a very good uptake. And then we've also had other models where, particularly like in areas like KZN, where the district hospital has taken the responsibility for the entire district. So how they're working is they work on what they call a hub and spoke model, where the hospital is the hub, and in each of the clinics are the spokes. And through working with local community assets like traditional leadership, traditional healers, and community health workers, they were able to mobilize people ahead of vaccinations. So the actual uptake was actually quite good.
Yeah.
I think the challenge that we have now is that it's very expensive to do this. And I think one of the ways that we can improve vaccination coverage in rural areas is maybe just to open the vaccinations to all 18 over, because it makes both economic and program sense to vaccinate people when they are there.
So you want to do larger numbers if you're in a specific area. Also, I mean, if you've got younger people, the 35 pluses are eligible now. One of the constraints has been cited as having a phone, being online, being able to respond in English. So can those younger people help the elderly folk?
I think that was generally that's the idea, that the young, if you look at the rural populations, there's a big majority of young people and a large percentage of older people. Many of them are underemployed at the moment. And I think this could be a nice way of ensuring that everybody gets vaccinated. So when I take my granny to the vaccination site, I can get vaccinated as well. But by opening up the qualifying criteria in rural areas in particular, because sometimes the populations are so small, it makes sense just to vaccinate everybody while you're there.
Yeah. And there was concern about Pfizer, the cold storage. We spoke to the MEC from Limpopo. Like you said, Limpopo actually doing very well. And she said it isn't as bad as they thought. And I guess that'll be even easier when we're using a lot of Johnson & Johnson vaccines.
Yeah, I think the Johnson & Johnson single-shot vaccine is ideal for the rural areas because then you lose that follow-up of having to get people back for the second dose. So we've done well to get the first dose, but only time will tell whether we'll have the same commitment and resource allocation to ensure that people come for their second doses. But as far as the cold chain, a lot of evidence has evolved. Initially when we first heard about Pfizer, the cold chain conditions were quite extreme. You needed to store the vaccines at minus 30 degrees, and you had to vaccinate within 6 hours of defrosting them, and there were some challenges. But I think once the rubber hits the road, people adapted. The evidence also evolved to suggest that the vaccines were stable for a longer period, and it alleviated some of those cold chain pressures.
Yeah.
And by and large, that's why the country has been able to still do rural vaccinations as we wait for additional supplies of the Johnson & Johnson vaccines which unfortunately have been delayed. And we haven't had any clear indication as to when that supply of Johnson & Johnson vaccines will be normalized.
So hopefully soon, that was the idea, that millions would start coming online. Limpopo, is it still doing well? I think we spoke to the MEC last month, and Limpopo, one of the poorest provinces, one of the most rural, but saying it can reach herd immunity if all goes well. And she was talking about influencers, social media being used to create a real buzz there.
Yeah, I think, vaccines make sense. And I think the best way to counter vaccine hesitancy is to get more people vaccinated. I think one of the things that we saw, even before the launch of the Sisonke operational trial for healthcare workers, there was actually a fair amount of vaccine hesitancy amongst healthcare workers within facilities. But once the vaccine became available and people at their facility got vaccinated, the numbers started picking up quickly. And I think the same thing applies in the general population. As long as the vaccine is not available, it creates that void of information, and disinformation sort of just prospers. But as soon as we start having more people in our community being vaccinated, right, more and more people will be willing to vaccinate. We've already seen that in the studies from Blitzkrieg, where they said a large percent, even up to 80% of people would take the vaccine if offered. But the longer we wait, the more opportunities we allow for disinformation. So I think the more we make them available, and by any means necessary, be it using local assets like churches and traditional leaders, community health workers, or social media influencers. I think whatever we need to use, if it works, we should use it and try and get as many people vaccinated in the shortest possible time.
All right, thank you for that analysis. And yes, a lot of misinformation right now. I think we should address that when in fact the research overwhelmingly suggests that these vaccinations save lives. Program Manager, Health Systems and Policy Rural Health Advocacy Project, Russell Rensburg.